Hi there. My name is Yana Jacobs. I'm speaking to you from Santa Cruz, California in the US. Um, I've worked in the mental health field for over 40 years. I started my career at a very alternative place, a social model that was a research project called Soteria House. Some of you may have heard of Soteria. It's now gaining a lot of popularity in the US and across the world. My understanding is Israel has created about 11 different sites. They've transformed their whole mental health system to reflect the Soteria philosophy, and the insurance companies included have been paying for that. Just to give you a little background, Soteria was a research project where they took first people who were having their first episode of psychosis, their first really serious mental health challenge, often with young people, college age, anywhere between 18 and say 25 was a typical time when people have a first break or really have their first experience of an extreme state. And they got the opportunity to go the traditional route, which was a locked psychiatric hospital, or they were invited to come to Soteria House, an unlocked setting where they would be offered meds, but not forced medication. And don't keep in mind, these are people having an extreme state. Normally in the US, they would have been hospitalized, but they were given this option. So I worked there for a few years and I didn't know anything about mental health at the time. I was really an art student studying art therapy, and I was just hanging out with people. And the model at Soteria was to really embrace the idea of being with people and not labeling them and not judging them and not thinking of them as ill, but just being with someone. And I was very comfortable doing that. I was young and I thought it was kind of cool to be with people who were in these altered states of consciousness, is what it seemed like to me. And so we would go through the psychotic process together. And my role was to make sure somebody was basically safe while they were experiencing what they were experiencing. Safety would be if somebody got naked and wanted to walk out on the street, I would redirect them back into the house, or I'd throw a blanket over them. But if people needed to stay up all night, they could stay up all night. If they wanted to make funny concoctions of food in the kitchen, they could do that. If somebody was really not sleeping for days and days, we all know that anyone who stops eating and stops sleeping for really more than 3 days, you or I, we're all going to get psychotic. It's the body can't tolerate no sleep and no food. So we would, of course, be encouraging sleep and doing mindfulness type of exercises to try to get people to relax and to rest or to sleep, even if they could just take cat naps. We would offer them medications for short term. It wouldn't be to really snow somebody with meds so that all they could do was sleep for days and days, but they would get offered something to help them sleep if they chose to take it for a few days. And then once they seemed like they were waking up and wanting to see what life was like again, we could take them off the medications. They could take themselves off. All of it was voluntary. But that's just very briefly how Soteria operated. And then move forward, I was asked to come work in the public sector, in the community mental health system in Santa Cruz, California, a typical public mental health system. They thought if I could work with people who were unmedicated, I could work with anybody, which was probably true, because even psychiatrists often won't meet their patient when they're in an acute state until after they've been medicated. So the nursing staff will medicate someone, and then the doctor comes in the next day. And by then the person's usually pretty heavily sedated. Well, I would be the person doing those evaluations at the front door. So I saw everybody in their natural state before they got medicated. I really took the job thinking I could change the world. I was young and naive, and I thought, okay, they're going to hire me and I'm going to keep everybody out of the hospital and I'm going to help everybody find another way to go through their psychosis. So I discovered a lot of people wanted to be in the hospital. It was viewed as a safe place. It was, for some people and families, they wanted to get a diagnosis. They wanted to be told what's wrong with them. That's understandable. You're confused, you're scared, and nobody gives it a name, and everything else in medicine is given a name, whether you have some form of a horrible form of cancer, you hope it's treatable, whether you have a heart condition or whatever. But in mental health, You know, people were anxious to get labeled, and then they could say, I have schizophrenia, I have bipolar disorder. And sure, there's some embarrassment, a lot of it, a lot of shame around a lot of these diagnoses, but at least people could be told, here's what's wrong with you, and here's the pill that's going to fix it. So, you know, and in the 80s, people thought that the medication was going to be the silver bullet, was the magic that was going to make everybody better. So fast forward another 10 years and nobody was getting better. People were on these medications. They were really becoming zombies. They couldn't work. They couldn't go to school. Families had lost their brilliant loved ones that were off in college and suddenly had a break. And now we're staying at home and drooling and not doing anything. But the drugs were not curing anyone. Not only were they not curing people, people didn't have quality of life. It hasn't been looking good with the medications. So, you know, there I am. I saw what happened at Soteria, that a lot of people, at least 50%, if not more, got well and moved back, got back on track, went back to school, lived their life, and they were okay. And so I was curious, like, why is this happening? And so there I am in a community outpatient setting. There's inpatient for the most acute, there's outpatient for everybody else. And I could see that people who found a good case manager, a good therapist to connect with, they often got better. And they would, if the doctor would allow them, which is rare, the doctor, if they said to the doctor, I can't function with these meds, I can't think, I'm gaining all this weight, some doctors would allow them to slowly start reducing their medications. I started seeing people get better when they could lighten up the meds. And now I'm going to fast forward again. I mean, I think what I've learned watching both systems work is that I would like to see a system where people are offered first the Soteria-like model, that they are given a chance to go through their acute state in a safe environment. If they need a little meds, that's fine. It's a crisis. You can help someone through their crisis. I want people to be comfortable and not, you know, not sleeping for days and days. But I really feel like it makes more sense, since nobody knows what causes these extreme states, to try to understand them as something triggered it, some kind of a trauma in somebody's life. Everyone thinks a trauma has to be something horrific, like a rape or a murder, but it doesn't. I mean, we are sensitive human beings, and there's a big scale of sensitivity. And there can be a very sensitive person where something that I might not really think is a big deal was a big deal for them, enough that it made it so they couldn't sleep anymore. They were so stressed and so worried. And when you allow that person some understanding and you ask them, what happened? When did this begin? When did you stop sleeping? When did you start feeling like you could concentrate in school? You really dig deep to find out when did this begin? When did things start changing? And you might interview their mom or their dad or their siblings or a boyfriend or a girlfriend or a school teacher, but you try to gather all the information and figure out something triggered this. And I think 90% of the time we can find out what happened. And when you know what happened, the pieces start to fall back together, because then you can really bring in the right kind of therapeutic support. And it doesn't take a pill anymore. It really takes tender, loving care. It takes an understanding person. It's a human connection. And I think we have undervalued the human connection, and everyone's in a hurry to take a pill and get better. And all I know now from years and years is that the medication honestly harms people, long-term use, not short-term use. I'm not going to criticize short-term use, because I think there's a place in a crisis to use it, especially if somebody wants it. It should be a choice. But to keep people and give people a message that you have a mental illness and you need to be on these medications the rest of your life is simply not true. And we need to stop telling people that, because it's a hope robber. It takes away hope. And there's no scientific evidence that no one's ever going to get well. In fact, there's much more evidence that if you get people off the medications once the crisis has ended, and you give them therapy and you give them support systems, they're going to have a chance to put the pieces of the puzzle together and understand what happened. And maybe they can avoid situations that will trigger that kind of an episode, but they have the power to do so. So I really believe that in psychiatry, you'll notice that we have very few psychiatrists. It's very difficult to attract doctors into the field. Why? People used to go into psychiatry because they wanted to be like Freud. They wanted to do analysis. They wanted to actually talk to their patients. They were people who were interested in who you are and where you came from. And I don't think, doctors are starting to find out that they become a medication mill, meaning they are basically there to prescribe medications every 15 minutes. And the insurance companies expect them to see you, make a diagnosis, make a prescription, and on to the next person. You do not have a satisfying, it's not a very rewarding job. So I think that's partly why people aren't choosing that in the medical field. And you've got a lot, how many places do you go where you've got clients out in front picketing a conference, a medical conference? In the United States, if you go to a psychiatry conference for a big university, you'll see hundreds of people protesting electric shock treatments, forced medication, forced treatment. You don't see that at a cancer conference. Nobody's objecting to the research and the work that's being done. So I think it's a very controversial field. And I think it would be less controversial if you could treat people with dignity and respect and listen to them and ask them what they need and try and get the bigger picture of their life and not think of it in chemical terms, because we're human beings and we're complex, and we need to be understood. We want to be understood, and we really want to be connected. And the medical model lacks all of that. No one gets a feeling of being known. They don't get a feeling of being connected with another human being. And it continues the alienation, and you're going to just spiral into a state of, an extreme state. If you feel really alienated and disconnected, it's not a good place to be. So I just want to also add that my perspective, and I've talked to other professionals and researchers about this number, is that on a gut feeling, I feel like about 75 to 80% of the people that I've seen go through the mental health system, that it was triggered, that their extreme state seems to have been, you can unwind the tape and find out that there was some trauma at the root of that. And if you know the trauma and you find that out together, through a therapeutic relationship, you can start working on, the harm that trauma caused the person, and they can learn how to deal with it. The tragedy is that everybody that goes through mental health gets treated the same way, meaning we don't find out in a universal systematic way what the trauma was. So we treat everybody as if they have a mental illness. Everybody gets put on meds. Everyone gets kept on the medications. And we're harming about 75 to 80% of our population who goes through the psychiatric system. That I think there is a mystery group of 20, 30% that really we can't figure out what the trauma is. It doesn't appear there was one. And maybe this group of people, maybe they really do have some chemical thing or some genetic, that science, the brain is complicated, and no one has found that answer yet. And I don't think they will in my lifetime, but I know there's science that's working on that. But the tragedy is that everybody gets harmed rather than, trying to sift out who are the people that had a trauma, and then just, medicate and support the people that we can't find the trauma, and they will tell you, yeah, I'm tormented by these voices, and the medications don't cure me and they don't fix it, but at least they give me a little relief. And if that's what I'm all for choice. And if somebody wants the medication, who am I to say they can't have it? I'm not going to make somebody suffer, but I'm just trying to make the point that we're harming way too many people by treating everyone like they all have an illness and they all need to be medicated, when I think it's a much smaller percentage that need the medication to feel comfortable, and the rest would probably move on and live a perfectly normal life without the label. I'm going to stop there for a minute and see if there's any questions.